Hi friend, my name is Sudeep. Welcome to my YouTube channel Pharmacy MCQ Guide. Now today we discuss about the topic insulin and anti-diabetic drug MCQ. 25 selective and important questions are discussed in this topic. Okay. Now the first question is which amount of amino acid contain the B chain of the insulin? Which amount of amino acid contain the B chain of the insulin? Actually, at first, insulin, what is the nature of insulin? Actually, insulin is one type of polypeptide which contain two types of chain, A chain and B chain. So this A chain contain 21 amino acid and B chain contain 30 amino acid. So total insulin contain total 51 amino acid. So the right answer is option number A 30, option number B 50, option number C 21, option number D 51. So the right answer is 30. Option number A is the right answer. Means insulin is one type of the polypeptide. It contains A and B chain, A chain and B chain. So A chain contain 21 amino acid and B chain contain 30 amino acid. Question number 2. Human pancreas contain which amount of insulin? What is the source of insulin? The beta cell of the pancreas, islets of Langerhans cells. Okay. So option number A 8 mg, option number B 5 mg, option number C 10 mg, option number D 1 mg. Actually, right answer is option number A 8 mg. Human pancreas contain 8 mg of insulin. Now we convert the milligram to unit. 1 milligram equal 28 unit. So 8 milligram equal 220 unit. Means human pancreas contains 8 milligram equal 220 units of insulin. Option number A is the right answer. Question number 3. The mechanism of insulin by inhibiting the activity of option number A voltage gated potassium channel, option number B ATP sensitive potassium channel, option number C calcium gated potassium channel, option number D all of the above. Now at first, the potassium channel is generally main three types. Option number A voltage gated, option number B ATP sensitive potassium channel, option number C calcium gated potassium channel. Now insulin act by inhibiting the activity of ATP sensitive potassium channel. Means option number B is the right answer. Insulin act by inhibiting the activity of ATP sensitive potassium channel. As a result, depolarization occurs. So this depolarization promotes the calcium entry of the cell and insulin secretions. Okay. Now B is the right answer. Question number 4. Which neurotransmitter stimulate the insulin release? Which neurotransmitter? Option number A adrenaline, option number B dopamine, option number C acetylcholine, option number D somatostatin. Which neurotransmitter stimulate the insulin release? Actually, some neurotransmitter also stimulate the insulin release and some neurotransmitter also inhibit the insulin release. Okay. Now right answer is option number C acetylcholine. Okay. Acetylcholine is one type of neurotransmitter which stimulate the insulin release, but adrenaline and dopamine is one type of neurotransmitter which inhibit the insulin release, and somatostatin, that is released from the gamma cells of the pancreas, so it also inhibit the insulin release. Okay, so the right answer is option number C is the right answer. Question number 5. Insulin produces glucose uptake by which type of glucose transporter? Generally, 4 types of glucose transmitter are available. GLUT1, GLUT2, GLUT3, GLUT4. Insulin produces the glucose uptake by GLUT4 type of glucose transmitter. It is one type, important question. So option number A is the right answer. Okay. Question number 6. Insulin metabolism occurs in option number A liver, option number B kidney, option number C both, option number D none. Actually, insulin metabolism occurs in both liver and kidney. Liver and kidney is the main place or source of any drug metabolism. Okay, but problem is in the liver, hepatic insulinase enzymes are present in the liver. This enzyme inactivate the 60% of insulin. So kidney is the best source for the metabolism of insulin. So right answer is option number B, kidney. Question number 7. Give an example of ultra short acting insulin. Option number A, insulin lispro. Option number B, regular insulin. Option number C, isopen insulin. Option number D, insulin detimir. Actually, now we see the classification of insulin. Actually, based on the duration of actions, the insulin may be classified 4 types. Ultra short acting insulin, number 1. Number 2, short acting insulin. Number 3, intermediate acting insulin. Number 4, long acting insulin. Actually, option number A, that is the insulin lispro. Insulin lispro is ultra short acting group of insulin. Option number B, regular insulin. Actually, regular insulin is one type of short acting insulin. It is generally given intravenously. Option number C, isopen insulin. It belongs to the group of intermediate acting insulin. Option number D, insulin detimir. Insulin detimir belongs to the long acting insulin. So option number A is the right answer. Insulin lispro is ultra short acting insulin. Question number 8. Lenti insulin is the mixture of option number A 30% semi-lenti and 70% ultra-lenti. Option B 70% semi-lenti, 30% ultra-lenti. Option number C 50% semi-lenti plus 70% ultra-lenti. Option D 10% semi-lenti plus 90% ultra-lenti. Actually, this lenti insulin is one type of intermediate group of insulin. But this lenti insulin is a mixture of, right answer is option number A, 30% semi-lenti and 70% ultra-lenti is the right answer. Question number 9. Why inhaled insulin withdraw from the market? Actually, the insulin is generally given by the subcutaneous route, but it is also given by intravenously. But in previous era, some inhaled insulin means insulins are administered by the inhalation technique, but it produces some problem. It also produces both pharyngitis and pulmonary fibrosis. Pulmonary fibrosis means the destruction of the lungs, and pharyngitis means inflammation of the pharynx. So inhaled insulin produces both pharyngitis and pulmonary fibrosis. So for this disadvantage or for this type of side effect, inhaled insulin withdrawn from the market nowadays. So the option is option number D, both B and C is the right answer. Actually, the example of inhaled insulin is Afrezza. Afrezza is one type of inhaled insulin, and Excerba. Excerba is one type of inhaled insulin. Question number 10. The example of second generation sulfonylurea group of antidiabetic. The example of second generation of sulfonyl group of antidiabetic. Actually, we see the classification of antidiabetic drug means drug which are used in treatments of the hyperglycemia. So now first is sulfonylurea group of antidiabetic drug. Second is biguanide derivative of antidiabetic drug. Third is maglinide group of antidiabetic drug. Fourth is alpha acarbose inhibitors. 5 is thiazolidine and derivatives. And 6 is DPP4 inhibitor. So in these various types of classification are available in the antidiabetic drug. Now option number A, the example of the second generation sulfonyl group of antibiotic. Now we see the classification of sulfonyl group of antidiabetic drug. First generation sulfonyl group of antidiabetic drug is tolbutamide. Option number A is the tolbutamide. Option number B is the glipizide. Option number C is the chlorpropamide. Option number D is the all of this above. Actually, option number A, tolbutamide, belongs to the first generation of sulfonyl group of antidiabetic. Option number B, glipizide, it belongs to the second generation sulfonyl group of antidiabetic. Option number C, chlorpropamide, belongs to the first generation group of antidiabetic drug. So the right answer is option number B, glipizide. Question number 11. Why sulfonylurea group of drug not used in the pregnancy? What is the reason? Option number A, cross the placental barrier and cause the fetal hypoglycemia. B, produces the weight gains of the pregnant mother. Option number C, cleft plate of the child. Option number D, all of this above. Actually, right answer is first option. Sulfonylurea group of drug crosses the placental barrier and cause the fetal hypoglycemia. I mean, hypoglycemia is the main side effect of sulfonylurea group of antidiabetic drug. Option number C, cleft plate of the child. It is a side effect of phenytoin, means anti-epileptic drug. So the right answer is option number A. Why phenformin banned from the market? Option number A, GIT distress. Option number D, lactic acidosis. Option number C, liver toxicity. Option number D, none of these above. Actually, phenformin banned from the market because it produces the lactic acidosis. Lactic acidosis means underutilized and overproduction of the lactic acid. So the body is not able to these changes. As a result, also liver damage occurs. So phenformin banned from the market because it produces the lactic acidosis. Option number B is the right answer. Question number 13. The duration of action of the metformin. What is the duration of action? The metformin is the common drug. Metformin is common antidiabetic drug. So the duration of action of metformin is 6 to 10 hours. Option number A, 6 to 10 hours. Option number B, 10 to 12 hours. Option number C, 1 to 2 hours. Option number D, 4 to 5 hours. Option number A is the right answer. 6 to 10 hours is the right answer. Question number 14. Which vitamin should be used with the metformin? Option number A, vitamin B12. Option number B, B6. Option number C, vitamin B3. Option number D, vitamin D. Actually, in the regular use of the metformin, when a patient uses metformin regularly for the diabetic purposes, in her body, vitamin B12 deficiency also occurs. Okay, so vitamin B12 should be used with the metformin. So option A is the right answer, vitamin B12. Question number 15. Give an example of antidiabetic drug which is used in the polycystic ovarian syndrome. Okay, what do you mean by the polycystic ovarian syndrome? Actually, polycystic ovarian syndrome means multiple cyst occurs in the ovary. Okay, so option number A, glimipride, option number B, metformin, option number C, teneligliptin, option number D, glibenclamide. Actually, right answer is option number B, metformin. Metformin is one type of the antidiabetic drug which is also used in polycystic ovarian syndrome. Question number 16. Give an example of alpha glucosidase inhibitor used in the type 2 diabetes. Example of alpha glucosidase inhibitor. This alpha glucosidase or alpha acarbose inhibitor, okay, is one type of classification of antidiabetic drug. So option number A, voglibose, option number B, rosoglitazone, option number C, glibenclamide, option number D, teneligliptin. Okay, so option number B, it is a wrong answer because rosoglitazone belongs to the thiazolidine derivative. What is the mechanism? The rosoglitazone act by inhibiting the ppar gamma. ppar gamma means proliferation paroxysm activator gamma. Proliferation paroxysm activated gamma, ppar, which is one type of nuclear gene. So rosoglitazone also activate these types of the gene which also increases the insulin secretion. This is the mechanism of option number B, rosoglitazone. Option number C, glibenclamide. It belongs to the second generation of sulfonylurea group of anti-diabetic drug. What is the mechanism of glibenclamide? The glibenclamide act by inhibiting the ATP sensitive potassium channel. When the inhibition of the ATP sensitive potassium channel, depolarization of the beta cell occurs. As a result, which promotes the calcium entry and promotes the insulin secretions. Option number A, voglibose. What is the mechanism of voglibose? It acts by inhibiting the alpha glycosidase inhibitor or alpha acarbose inhibitor. As a result, what is the function of alpha glycosidase or alpha acarbose? Now this enzyme, alpha acarbose enzymes, also helps the breakdown of the starch or disaccharide to the monosaccharide. But when these enzymes also inhibited, as a result, the breakdown of starch or disaccharide to the monosaccharide does not occur. As a result, the problem of digestion occurs. Okay. Option number D, teneligliptin. What is the mechanism of teneligliptin? The teneligliptin acts by inhibiting the enzymes DPP4. What is the full form of DPP4? Dipeptidyl peptidase 4. Dipeptidyl peptidase 4. Okay. So option number A, voglibose, is the right answer. Question number 17. Give an example of antidiabetic drug is more contraindicated in the inflammatory bowel syndrome. Option number A, teneligliptin, option number B, voglibose, option number C, metformin, option number D, both A and B. Actually, option number B, voglibose, is the right answer. Means voglibose is an example of antidiabetic drug which is contraindicated in the inflammatory bowel syndrome. Why? But why? Actually, voglibose is one type of alpha acarbose or alpha amylase inhibitor. Alpha amylase is responsible for the digestion of many foods and complex carbohydrate. So voglibose inhibiting this alpha amylase or alpha acarbose. As a result, the digestion problem is occurs. Okay, but in case of inflammatory bowel syndrome, already inflammation also occurs in this patient. When voglibose is prescribed in this patient, or when patient take the voglibose, it aggravates the inflammatory bowel disease. Okay, so the right answer is option number B. Question number 18. The mechanism of rosoglitazone. Option number A, inhibiting the alpha amylase. Option number B, inhibiting the potassium channel. Option number C, activate the ppar gamma. Option number D, none of this above. Now first discuss the mechanism of rosoglitazone. Option number C, activate the ppar gamma. is the right answer. What is the full form? Proliferator paroxysm activated receptor gamma. It is one type of nucleus gene which is present in the muscle cell, okay, which also stimulate the insulin secretion. Question number 19. Give an example of antidiabetic drug used in the bladder cancer. Option number A, pioglitazone. Option number B, metformin. Option number C, glimipride. Option number D, voglibose. It is one type important question it is. So option number A, pioglitazone, it belongs to the thiazolidine group of antidiabetic drug. It is also used in diabetic purposes, but it also has an activity of bladder cancer. Means option number A is the right answer. Pioglitazone also have an activity for the treatments of bladder cancer. Option number 20, question number 20, the mechanism of vildagliptin. What is the mechanism? Option number A, activate the ppar gamma. Option number B, inhibit the DPP4. Option number C, alpha acarbose inhibitor. Option number D, all of this above. Now first discuss the activated the ppar gamma. It is not. It is the wrong answer because it is the mechanism of rosoglitazone pioglitazone. Option number B is the right answer. It inhibits the DPP4, means dipeptidyl peptidase 4 enzymes. Okay. So option number C, alpha acarbose inhibitor, it is the mechanism of voglibose. It is the wrong answer. So right answer is option number B, inhibit the DPP4. Question number 21. Why vildagliptin produces the nasopharyngitis in the regular dose? When the patient take the vildagliptin in regular basis, nasopharyngitis occurs in this patient. Because what is the reason? Option number A, substance P release. Option number B, histamine. Option number C, serotonin. Option number D, all of this above. Actually, substance P is one type of inflammatory substance. Substance P is one type of inflammatory substance. Actually, this is the right reason is option number A. Vildagliptin releases the substance P, which is one type of inflammatory substance. B and C is not right answer. Okay, option number A is the right answer. Question number 22. Give an example of SGLT2 inhibitor used in hyperglycemia. What is the full form of SGLT? Now, sodium glucose transporter. Sodium glucose co-transporter, which is used in hyperglycemia. Option number A, vildagliptin. Option number B, sargliflozin. Option number C, voglibose. Option number D, all of this above. The right answer is option number B, sargliflozin, because vildagliptin is the inhibitor of DPP4. Voglibose is alpha acarbose inhibitor. So the right answer is B, sargliflozin. Sargliflozin is the inhibitor of SGLT, or the sodium glucose co-transporter 2. Option number B is the right answer. Question number 23. The main side effect of sargliflozin. Option number A, polyuria. Option number B, polydipsia. Option number C, sodium loss. Option number D, all of this above. The main side effect of the sargliflozin is all of this above. Option number D, means it produces both polyuria, polydipsia and sodium loss in our body. Which antidiabetic drug produces the disulfiram-like action? What is the function of disulfiram? Actually, it is the inhibitor of alcohol dehydrogenase. So it is used in alcohol poisoning. So which antidiabetic drug? Option number A, metformin. Option number B, chlorpropamide. Option number C, voglibose. Option number D, teneligliptin. Option number B, chlorpropamide, is the right answer. Chlorpropamide belongs to the group of first generation sulfonylurea derivative. So chlorpropamide have an action of disulfiram-like, means it produces the enzyme alcohol dehydrogenase. So it is used in alcohol poisoning. Question number 25. Last question is, give an example of antidiabetic drug which also have the antiplatelet activity. Antiplatelet activity means it prevents the platelet adhesion and platelet aggregation, like aspirin. So option number A, tolbutamide. Option number B, glimipride. Option number C, metformin. Option number D, teneligliptin. Option number B, glimipride, is the right answer. Means glimipride also have antidiabetic activity and antiplatelet activity. Okay. Option number B is the right answer. So please like, share and subscribe my video. Thank you.